Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
is less than the pathological short stature. Pathological short stature can be of two types: disproportionate pathological short stature or proportionate pathological short stature. In disproportionate pathological short stature, here upper segment and lower segment does not match. That can be of two types: infantile disproportionate pathological short stature or advanced disproportionate pathological short stature. In infantile cases, the upper segment ratio by lower segment ratio is more than the expected. That is, the trunk of the baby is long and extremities are short. For example, achondroplasia, congenital hypothyroidism, and rickets. In achondroplasia, congenital hypothyroidism, and rickets, the trunk is short and the extremities are long. Whereas in advanced type of disproportionate short stature, here the upper segment is to lower segment ratio is less than the expected. That means the trunk is short and the extremities are long. So this is mainly seen in spondyloepiphyseal dysplasia. Then we have proportionate short stature. In proportionate short stature, the upper segment and lower segment ratio matches with the age. So what is the ratio of upper segment is to lower segment? That is, upper segment to lower segment ratio is called as body proportion ratio. At birth, the body proportion ratio or the upper segment to lower segment ratio is around 1.7. At 2 years of age, it is 1.5. At 3 years of age, it is 1.3. And at 6 years of age, it is 1.1. And at 7 to 10 years of age, the upper segment to lower segment ratio is around 1.
thank you and thank you for watching.